So when we talk about NTRK fusions, it should be noted that there are some tumors, both in adults and pediatric population, that have this fusion occurring more frequently than some others. So, for example, the secretory carcinoma of the salivary gland and the secretory breast carcinoma all have 75% or above. And there are some other tumors like lung cancer, for example, which we're talking about today, where the frequency is less than 5%. In fact, for most population-based studies is less than 1%. Next slide, please. So again, as you note here, there are some that are the fusion is actually defines the tumor. It's necessary for diagnosis as well. For example, the secretory breast carcinoma or similar secretory analog salivary gland carcinoma, infantile fibrosarcoma, where the frequency is over 90%. Whereas in lung cancer, the frequency is much less. And in fact, these fusions can occur in leukemias and other liquid malignancies as well. Next slide, please. So what I want to say here is that it is really, for some tumors, it is like searching for a needle in a haystack. There are many ways you can perhaps search for a needle in a haystack. You can put your head in it and search for it, rummage through the entire hay, or you can try to use a magnifying glass and try to look through every part, or you can have it color-coded and see if you can identify it faster. You can perhaps use a magnet, perhaps, or do an X-ray, or perhaps use multiple methods. And that's what seems to have, perhaps be the best strategy here when we are looking for NTRK in lung cancer. Next slide, please. So how do we implement the NTRK fusion testing in clinic? So we'll talk briefly about the tools to find these fusions, and when and how to test patients, and strategies for optimal testing and obtaining results in a timely manner. Next slide, please. So there are many algorithms that have been developed. This is the ESMO recommendation, where you, first of all, identify the histological type, where the tumor came from, and if it is something that is highly associated with the NTRK fusion, then you go on to do a confirmatory technique. If it is not something that is frequently associated, then I think sequencing is extremely important. So the next generation sequencing is important. We'll talk about the DNA platform and the RNA platform, but essentially we will need that to identify. But if that's not available, there are some other cheaper, easier techniques that can sometimes be used and can be perhaps used as a screening tool. And we'll talk about that again. Next slide, please. Okay, so this is perhaps another way another algorithm to consider, again, based on histology and then based on genomic testing. Again, if it is lung cancer here, if you can look at the bottom left, this is not very common. So next generation sequencing has become, fortunately, a very common thing. It's a normal thing for us to do. And again, there are differences between DNA testing and RNA testing here. And we'll talk about that. Next slide, please. So this is the immunohistochemistry. As you can see, there are different, if you do the immunohistochemistry, you can actually see the protein. This is the TRK-AB, it's a pan-TRK protein that is stained. You can see where exactly the protein is located. Is it within the nucleus? Is it within the membrane? Is it within the cancer cell? Or is it within the normal lining? So it is an important way to kind of look into this, but it doesn't give us much details, much more than the staining itself. Next slide, please. So what are the possible ways to test? We spoke about the immunohistochemistry, which you saw on the previous slide. It is just staining the cells for the TRK1, the TRK-A, B, and C, and then you get rapid results. You just perhaps need just one slide. But when we are looking for when we have very little tumor material to work with, you can do slides for pretty much every gene. So it becomes important when you're looking for multiple genes in the same specimen. FISH is another test. I didn't go too much into it, but basically it looks at, again, the part of the NTRK is stained, and then a part of another molecule, the common partner is stained, and then we see whether the two are together or they're apart. And there are different ways of doing it within FISH itself. And again, it requires a couple of slides, maybe one or two slides, gives rapid results, but it doesn't really give us information about what the exact fusion partner is, and sometimes it doesn't tell us if it is really an important fusion that has led to cancer as well. The next generation sequencing is what we use today. And this is rapid throughput. Entire gene is searched through for multiple genes, and then the fusion partners are identified. There's a longer wait time, and of course, there's a cost associated. When you look at the reports, you might see that it's a DNA-based assay or an RNA-based assay. Both of them are pretty good, but it should be, I just want to point out here that the RNA-based assay, meaning is the DNA, is the print, right? I mean, is the nuclear print, and then you have the RNA. The RNA is right next to what the protein is. So it gives us more information about whether what the DNA actually did, what was actually transcribed, and what led to cancer. So the RNA-based sequencing is a direct information, and it's also more sensitive, and it's helpful to detect some rarer fusion targets because there are so many targets. There are multiple targets that are identified.